Hello, welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschnauer with the Kanawha-Charleston Health Department, and today we are joined by a special guest, Holly Mitchell with the American Heart Association. Today we're going to talk about a subject that is dear to many West Virginians, and that is hunting. In particular, we're going to talk about healthy hunting. And with that, Holly, welcome to the show.
Thank you for having me.
So tell me why hunting and the heart, what of those two go together?
Well, it's a huge tradition here in the Mountain State, and we have noticed that a lot of folks who go out, they actually have some cardiac emergencies. So last year, we put this out there to make sure that when you go out to hunt, that you actually have a checkup to see how your heart's doing, because 25% of the calls that come into the DNR, they're actually cardiac emergencies.
That's pretty staggering. 25% of calls that come into the West Virginia Department of Natural Resources during the hunting season are due to cardiac emergencies.
Yeah.
Who would have thought that there would have been that many cardiac events? But if you think about it, if you've not done some exercise or prepared yourself or had that doctor checkup, that you might have a cardiac emergency out in the woods when you see that big buck.
Yeah, and definitely the thrill of going out into the woods and all the prep, and it does get your heart going. But what we're trying to do is that people that would go out and they prepare, they pack their gear, they get their lunch and all this other good stuff, is that they have to have a plan in place in case something happens, because no one thinks it's going to happen to them. And sometimes when folks go out, it's their first time probably in the year that they actually did something kind of strenuous. Because, going out and hiking out in the woods and, dark 30, it's cold, it's a jolt to your body.
Sure is. So let's talk about the preparation before you ever even go on a hunt. Let's talk about maybe the weeks before, like a doctor checkup to start with.
Yep.
So why does the American Heart Association recommend a checkup prior to?
Knowing your numbers is super important. A lot of folks walk around, they don't realize they have hypertension. And if you don't have that check with your doctor and you're going out hunting, it might be a really bad time, because you're out there, you do have hypertension, and then something would happen. So we recommend, first of all, telling folks where you're going. Give them an area, approximately when you're going to leave, when you're coming back. Cell phones are great, but sometimes you don't have service. So it's nice to have those times where if you don't hear from me by this time, check on me or tell a buddy or whatever. But when you're talking to your doctor, make sure, what was the last time I went to the doctor? What was my numbers again? What's my risk for hypertension? Am I at a healthy weight? Have I went out into the woods since last year? Have anything in my health has changed since last year? Maybe you gained a few pounds, maybe you've lost a few pounds. There's something that's going on that you need to check before you go out into something so strenuous.
Absolutely. As you know, as a physician that works in an emergency department for many years in West Virginia, I've seen a number of these unfortunate cardiac emergencies that occur out in the woods. So each of you that want to hunt out there this year, you don't want to be that guy. So the things that I recommend as well from a physician perspective is see your doctor, check on that blood pressure, make sure you're healthy enough to go out in the woods and do those strenuous activities. And when that buck fever hits and you have the big buck down and you have to try to drag that deer out, it's a lot of physical and very strenuous activity. So being prepared for that is very important, so you don't end up being one of those heart statistics that come out of the woods. Get your deer out of the woods, don't make them drag you out of the woods.
Yeah, exactly. That's a really good way to put it, because we've heard so many stories, and other physician friends, people that's told us about it, that they in a tree stand had a heart attack and nobody knew they were out there, and somebody else would find them. So be sure you have everything in place, that if you're not heard from in a while, somebody can come and check on you, and that before, maybe a couple weeks before you start planning your hunting, we're in the middle of hunting season right now, but maybe next year, get out there, start walking, doing hikes, getting used to being out in the woods, and that it's not your first time going out there, and having something so strenuous.
So senior doctor and now getting out and doing a little physical training, a little preparation, those walks in the woods.
Yes.
Try making it up and down a couple of those hills before you go out and really start straining yourself
Yeah.
at a level that you may not have done for a year or more.
Yep.
So let's talk a little bit more about the planning. You mentioned a little bit a minute ago about the plan of letting people know where you're at. So know where you're going to be hunting and that others know where you're going to be hunting. And then having your cell phone with you.
Yep.
And then timing, letting them know when you're going to go and when you should be back.
Yep.
And if you don't come back, that they know to start looking for you.
Yeah. And having an access to what's the nearest hospital, or do I have all my medications that I need too? Everything that you would need if you were out there for a while, backup things too. That would be very helpful.
So part of the plan, make sure you're taking those blood pressure pills with you. Oh yes, need to have those. Or any other medications that your provider or physician has prescribed for you.
Yep.
And then many of us go out and we hunt at a camp, and it may be in a county that we're unfamiliar with. So
Right.
yeah, knowing where and how everybody in the camp knows how to get to the local hospital
Yep.
where there is a close emergency department in the event that somebody does have an emergency.
Yeah.
Unfortunately, we will see some emergencies again this year, as we do every year.
Yeah. And if you're hunting with a buddy or you have a camp, it wouldn't be bad to brush up on your CPR training. Hands-only CPR, we're really trying to push that throughout our state because, it takes a minute in the Mountain State to get some help out there.
Oh, yes.
So, check out our website, go to some of the videos and think about it. When's the last time you had some CPR training? Because you could really be helping out someone that's, near and dear to you as you're going out in the woods and something would happen. Or you can help a fellow hunter too. I mean, if you're by yourself, but I don't recommend being by yourself.
I highly recommend that everyone receive CPR training, and the American Heart Association has great information on getting some training online or in person, both. There's in-person classes. It's very, very important. And you may not know this, believe it or not, my father collapsed in a grocery store. And a lady, she was actually an attorney that knew CPR, did CPR on him. Someone brought an AED and shocked him back into the rhythm, and he recovered fully from it. But had not someone who was standing by that knew how to do CPR, had they not done that, he wouldn't be with us today. And that's been probably 5 years ago that he collapsed
That's
with a
amazing.
heart rhythm. Got a pacemaker and is doing great ever since.
Oh, that's so great.
But thankfully, that Good Samaritan had taken CPR and saved my dad's life. And each of you that are hunters, you could be that lifesaver. Not just a hunter, but a lifesaver, all in the same stroke. So what other preparation? We were talking about knowing where you go, letting people know when and where, what time, having a cell phone, knowing where the ER is. Don't forget your medications. What other items?
Staying
on that list?
hydrated, taking water, heart healthy snacks, light snacks, that's pretty important too to keep if you're diabetic, definitely watch your sugar, watch what you're eating. Comfort foods are great, and you're going out in the woods. I saw some menu items, about the wonderful pepperoni rolls, of course. But think about it when you're out and you have a big meal and then you're going to be out, in the woods. Think about some things that would help you sustain energy and that are heart healthy.
Absolutely. Yeah, those are so important. Staying hydrated is key anytime you're doing a lot of physical activity. You've got on all those clothes, then you start hiking and then you get hot. So one recommendation that we always had is to layer your clothes so that you could take something off so you don't overheat.
Yep.
So don't forget good drinks and some heart healthy snacks.
Yep.
Heart healthy snacks. So we actually have a few videos, and each of these relate to heart healthy hunting, and they were sponsored by the American Heart Association. The first one, I'm actually the speaker in it, so we'll take a minute and take a look at that video from the American Heart Association. Be prepared for heart-healthy hunting. As an ER physician, I've seen this many times, strokes and heart attacks that occur while men and women alike are in the woods. Know the signs and symptoms of a heart attack and stroke. Be aware and be prepared. In the video, I really tried to highlight why it is so important to engage in heart-healthy hunting and to take care of yourself before you go out into the woods and not be one of those statistics of those who collapse in the woods and have a heart attack. We have a couple more videos. Delaney is also going to talk to us about some heart-healthy hunting.
So the reason I'm helping out is because around 5 years ago, my grandpa passed away from a heart attack. And the way that he passed away is he was out hunting with my brother and my dad and my great uncle and my cousins, and he got sort of a chest pain and decided to come back in. He had killed a deer, so he dragged the deer back to his four-wheeler and brought the deer in and went to his house. And he still had that chest pain, so he ended up calling my aunt. And my aunt was on her way to come pick him up and take him to the hospital. But then she was at a post office about 10 seconds away from his house, and he called her and told her that he was okay and that he didn't need her to come anymore. So she still came anyways, and when she came to his house, my great uncle was on the ground giving my grandpa CPR because he had had a heart attack. So the ambulance came, they took him to the hospital, and he was pronounced dead at the hospital from a heart attack. What it means for me to be a part of this is to help people that may not know that they have a heart problem or that maybe it runs in their family or something, just to be aware of the signs and symptoms so it doesn't happen to them. Talk to your doctor, make sure that you're A-okay and you're healthy, and exercise, do whatever you can to make sure that you're healthy so you don't have to go through something like this. Be safe and make every moment count, because it could all be over tomorrow.
In our last video, we're going to hear from Captain Goodson with the West Virginia Department of Natural Resources. As Holly mentioned earlier, the Department of Natural Resources, of all the calls that they receive during deer season, approximately 25% are related to cardiac events that happen with hunters in the field. It is so important that we try to prevent those cardiac events in the field by preparation, training, and making sure that your buddies also know CPR in the event that they need to not just be a hunter, but be a lifesaver. So with that, let's hear from Captain Goodson.
Say you already know that you do have a history of heart disease. You are seeing your primary care physician. You have medications, obviously. Let's make sure you have those medications with you to take in your hunting pack. Have a first aid kit. We always teach that in our hunter education classes as well. Medications, know your history, know your limitations. Received a call yesterday. A senior hunter is going to go out. Hey, can that young man assist me if I do harvest? Please do. Don't overexert yourself. Know your limitations. I think that's the most important thing there is know your limitations and have a plan in place. That way everyone knows where you may be while you are hunting. Don't think about heart health just one time a year during that hunting season. Think about it year round. That's the pump station, if you will, for life. Have those appointments with your doctor. Be informed of your health. And again, know those limitations. Don't trek off 5 and 6 miles into the woods and harvest an animal. Oh gosh, now I've got to get that thing back that much further. Be prepared. Have a plan in place. Make sure you. I think the most important thing is visit with your doctor and know what your medical history is.
Each of these videos really highlight the need to engage in heart-healthy hunting and protecting and preparing yourself, as well as protecting and preparing those in your family or your hunting buddies that you go out in the woods with. So thank you for watching those and for those great videos sponsored by the American Heart Association. So Holly, let's talk a few minutes about other initiatives that the American Heart Association has ongoing.
With our work with the community aspect, we actually have partners with clinics around West Virginia and some of our community partners. Some of our clinics, we do SMBPs, which is self-monitoring blood pressure programs with chronic disease patients, and that's mainly my focus. And we also do nutrition security initiatives with some pantries with the Union Mission. We are looking at some middle schools.
Let's go back to the blood pressure monitoring real quick. Self-monitoring blood pressure. As a clinician, I can definitely relate to how important that is, of how many emergencies that I see in an emergency room where someone is in a hypertensive crisis, that their blood pressure may be well over 200 systolic.
Yeah.
And preventing those episodes so that we don't end up with heart attacks and strokes that were definitely unanticipated. Why is that so important to the American Heart Association?
Well, as we talked about with the Hunting Heart Healthy campaign, is that knowing your numbers is super important, because we know that folks walk around and they have no idea that their blood pressure is so high, and it's normal for them. And what we're finding when we give cuffs to patients, it really empowers them that they're making changes and they're making themselves well because they're paying attention to that, and they're doing everything their doctors, telling them to do, taking their medication, and watching their numbers. It's like, wow, why is my blood pressure so high? Or maybe I need to talk to my doctor about changing my medication. Maybe I need to really look at my diet. Maybe I really need to start exercising more. So, and we've seen it time and time again with patients who monitor their blood pressure, they actually make changes.
It is amazing when you know your numbers and truly know your numbers, that it does make a big impact, because I frequently see patients that even come in that have checked their numbers and it's higher than normal, but not necessarily an emergency, but they're concerned about it enough that they come into an emergency department even in off hours, but had they not checked, they would have never have known.
Right, exactly.
And blood pressure is what we call the silent killer for so many reasons. So many patients, they don't have any symptoms at all. They feel fine. And I've heard that, well, I feel fine, doc. But in fact, they're not fine, because when that blood pressure stays up high for a period of time, the increased risk of long-term heart damage and a potential stroke are so high. And those are so sad, because this is so preventable. We can prevent many of these heart attacks, many of these issues, just by keeping that blood pressure under control. But if you don't know your numbers, you sure can't treat it.
Yeah, exactly. And it really, like I said, it goes back to empowering the patient that they do have something that they can do, and that they're just not, apathetic about it. They're not going to suffer. They can definitely try things to improve their health. Yeah.
And management of blood pressure is really, for most patients, is a pretty simple ordeal of either lifestyle modification, a little more exercise, a little less salt, a little less alcohol in their diet, or for some, they may need to actually take a blood pressure medication, which there are many out there that are very effective in keeping blood pressure down. That little pill could be a lifesaver for many.
Yeah, and it's really just talking to your doctor about that and having that relationship. There's been countless cases that we have talked to patients and there's I had no idea. We had my blood pressure taken, and next thing you know, I'm on a blood pressure medicine and I feel so much better, and then they go and they leave. And I think the rationale is what they need to learn too. Is well, why does having high blood pressure, affect my health? Why is that important? And like you mentioned about, prolonged elevated blood pressure does damage to the heart, and I think they need to understand that.
Oh, yeah, absolutely, absolutely. So let's move on to your next initiative. Sorry, we got on
Oh,
that
that's
little
okay.
sidebar
I get
there.
really excited about it.
Yeah, but that was such an important one. I really wanted to take a few minutes and talk about it a little more. But let's talk about the other initiatives that you were talking about, going all the way down into the middle schools.
Yeah, well, we have some of the pantries that we're working with the middle schools, and this became a new thing on our radar that some schools are providing meals for students after the school day and sometimes into the weekend because there's food deficits. So we're working with the Union Mission and some of the other schools to get these pantries into like a nutritional base where they're not just, shelves, I guess what you call it, like just how they store it. It's not fresh. So we definitely want to increase the fresh options, healthier options for the students. And that has been going very well. We started some of these initiatives and the students are actually asking for healthy foods. It's not just, oh, I want ravioli and macaroni and cheese. They ask for apples and carrots. And, we all know that eating healthier foods, it's better in the long run. And, when they're younger, this is such a good time to talk about healthy habits. And, definitely when people are hungry, it's not just, okay, we'll just give them what you have. It's like they should have a healthier option too, and they deserve it.
Sure.
Yeah.
Yeah, when people are presented with healthy options, it is amazing how often they choose it. And I see this with my own grandkids. Their parents are very cognizant about feeding healthy meals, and that a unhealthy item or candy is a treat. It's not a meal.
Yes.
It is a true treat, as if you've earned it.
Yeah.
But even when they come to our home, they ask for healthy options like fresh fruit, strawberries, or a banana, or blueberries, and of course the notorious apples that keep a doctor away.
Yeah.
But that is good because they've become conditioned that is real food when
Right.
you're actually really hungry and not a candy bar or just mac and cheese.
Exactly. Yeah. And what we're finding too with students who are fed well, they do well. They come to school, they have more attendance, behavior issues are decreased, academics, they do better. So all around, it's just a healthier choice for the students to have those. So that's what we've been working with some of the pantries to have like nutritional standards in place, fresh options like refrigerated items. So we're really excited about this project with some of the middle schools we have.
Oh, that's excellent, excellent. Here in West Virginia, diet is a big issue, as it has probably been one of the biggest issues driving a number of the diseases that we face, obesity, diabetes, high blood pressure, high cholesterol, all ultimately leading to early heart disease.
Yeah.
We have such a high rate of early heart disease, much of which could be prevented, but it is so important that we start young.
Yeah.
And that is very encouraging to see the American Heart Association recognizing that and pushing resources and education out to that.
Yeah. Yeah, and then a lot of the areas that we didn't realize, there's food deserts and food swamps. So it's like a learning curve for me, but food deserts, obviously there's very limited options to buy fresh food, and food deserts is like, most you could look at, there's a website like CDC, but food swamps, like there's available food, but it's not the best choice. So we want to make sure that we're getting into all those areas, food deserts and food swamps, to have healthier choices.
Yeah, I see that as such an important and a struggle, though, for many rural areas of West Virginia, where it's not convenient or easy to necessarily have a large number of fresh fruit and vegetable options available for individuals.
Yep.
Dining is another big one with the amount of fast foods that are available, and as good as it may sound, and it may be appetizing, but it's also usually probably the least healthy for us.
Yeah.
The amount of salt, the amount of fat, and the total calories in many of those meals can be pretty staggering.
Yeah, processed foods, not the best choice, no, certainly, and it lasts longer though. But you have to think about fast food, and that's even a personal choice for me. It's been really hard to okay, no more drive-through. We're all like that. So having that healthier foods, it's really made a difference for me and my family. Is some of the options that we have too, and we want to make sure that all families have that choice, that they could have healthier options.
One of the things that my wife has done to help improve that is for our daughters and our kids at home was to make them lunch, but make healthy meals specifically for taking to school or for me to take to work, and rarely go out to those fast food restaurants.
Yep.
It's like, oh, well, I didn't bring anything in today, so I've got to go get something to eat. And then you tend to eat bad versus if you've brought something that is a good choice.
Yes, and I think you really hit on something that's really important. A lot of people don't think about is prep. And we
Yes.
talked about, heart healthy hunting, prep. It's thinking before that, prepping your food. We do that at home too, cutting up those apples, having that broccoli, but it's thinking about it, because when you're out and you're like, oh my gosh, I'm hungry, I didn't really think about anything, and you go, that's what fast food is. But the prep, so we're teaching our middle school students that too. It's that they're, not just, food doesn't just fall out of the sky or whatever. You have to
Yeah.
think about where you're getting, your nutrition from, and what you could do, healthier options that are quick and that they don't cost that much, that they can actually prep that. So, and they can do that on their own as a middle school student.
Yeah, food prepping is so important because it actually starts even before you go to the grocery store, planning out that menu, selecting the items at the grocery store. And that means don't go to the grocery store when you're hungry, where you tend to grab, but
Yeah.
you go and you buy what you've put on your list.
Yep.
And then you have in your refrigerator or in your pantry what you really should be eating.
Yes.
And then prep your meals for the week. My daughter, she's in the Air Force, and it was kind of interesting of how she took like a class apparently, and she is now quite the food prepper. Every
Oh,
week
okay.
she does all of her shopping, and she has all of her food prepped and menu laid out for
Wow.
every week, and how important that has been to her, because now she's like, I hardly ever go out to eat
Yeah.
anymore because I've already brought my meals in for lunch every day and already have a menu planned for that week of what items that I'm having each evening. So she said, I feel like I'm eating so much better now because I prepared it in advance versus it's at the end of the day, oh gee, what are we going to do for dinner tonight? And then you tend to eat fast or quick options that are probably not the most healthy options for you.
No, and that's what we actually introduced the program that we're putting together for one middle school called Fresh Prep. And it's just thinking about food in a different way and preparing that, and preparing your body and your mind and your heart, really, when you think about it. And a lot of folks that they don't have someone to guide them about, well, this is what we've always done, we've always had this kind of meal, or we would always go out. Giving them the option to learn more about Fresh Prep. And like your daughter, it's just like, it's so much easier. It probably saves a lot of money too.
Oh, it does. Well, Holly, thank you very much for having you share about heart healthy hunting and the initiatives of the American Heart Association. It's, as always, a pleasure, and
Thank you.
we really appreciate the work that you're doing for our citizens.
Yeah, thank you so much.
Thank you.